Ableist, this is your human thesaurus, transcriber, content provider, spermologer, and nursing body. Back to it again for another videos of trivia of the day.
Hi, do you know this one? This is what we call blood. And we all know that blood is a circulating fluid in our body that provides oxygen, nutrition, and waste removal. And did you know that the average blood in our body is 5 liters? Have you ever seen this one occurred in your body? This one, a purple colored spots and patches that occurs over the skin. If you are a mother whose children have this kind of one, or a person who have menses who have this kind of situation, a colored purple patches, or a pregnant woman, then this video is really for you. So what you're waiting now, come and watch on my video. Tadaan! So, guys, what we are going to talk about today is one of the blood disorders, which is the idiopathic thrombocytopenic purpura. And this is a blood disorder characterized by a decrease in the number of platelets in blood. These platelets are the cells in the blood that help to stop bleeding. It means that if there is a decrease in platelets, there can cause of this bruising, bleeding gums, and internal bleeding. And one the factor that I've shown you earlier, the purple this reaction that I'm telling you is the immune reaction against one's own platelets. A decrease of our platelets in our body, which is what we call an autoimmune thrombocytopenic purpura. Hi, just a fun fact, did you know that a healthy individual has the platelets of 150,000 microliter of blood to 450,000? Hey, I've been talking earlier about idiopathic thrombocytopenic purpura. This disorder came from the idiopathic. When we talk about idiopathic, it means that this is any disease which is uncertain of or unknown agents. Because as we all know, this idiopathic we don't know yet what's really the main reason why it's occurring. However, we don't know the number one reasons why those T cells attacks our platelets or mistakenly attack our platelets. So when we talk naman thrombocytopenia, this is a decreased number of platelets of blood. And the purpura, which means to the purple discoloration of the skin, or these are the patches that occurs in the skin. That's why we call this one idiopathic thrombocytopenic purpura, which means an unknown cause of decrease of our platelets, which has a clinical symptoms of purple discoloration of our. So who are really those persons that really susceptible for this kind of disorder? As what I've mentioned earlier, those young children, these young children could have develop a type of thrombocytopenic purpura, which is an acute type. We do have also a young women who are on the menstrual period, because that's time a lot of menses that get out from their body, and those pregnant women as well, they are susceptible. So how would you know that you have a thrombocytopenic purpura? This is one of the main signs and symptoms that you need to watch out. So the number one signs of symptoms is a decrease of platelet count, often less than 3,000 micromillimeter or less than 500. So the next one is the bruising, and that is the example at my back. This is an inspired that's man is the main character in the Squid Game. Have you seen in this part? That is what we call a bruising. There is bruising on its part, and also that one at the knee. For an example, when there is no a clot formation there, or there's a decrease of platelet, it will just only stock the blood out there. So that's what we call a bruising. And the number next last is the heavy menses. For children's or for those young women who have menstrual cycle and it happens that there is a low platelets, they are susceptible for this one. It's because heavy menses, when you have a heavy menses, it means that your platelet doesn't even functions well. The next one is what we call the bleeding in the mucosa. This bleeding in the mucosa could also be bleeding on our nose. The next one is gastrointestinal bleeding. You might not see on your stool that there is a blood in it, then you have a gastrointestinal bleeding, or you need to go to the doctor and seek for a consultation. And number one, and the last one is the petechiae, or the extremities of the trunk. So what's up? We are going to talk about now the pathophysiology of the disease, or what is really the main reason or the mainstream of having this kind of disease of what we call the idiopathic thrombocytopenic purpura. So the first thing that we'll have to that happen here is yung ating body na produce ng antibodies, anti-platelet antibodies, which yung tinatawag na IgG antibodies. Bakit nga ba nagproduce ng ating body? So, unknown pa kung bakit nagkaroon. Pero, there is a speculations kapag or reasons why nagkakaroon ka ng anti-platelet, nag-produce ng ating body ng IgG. It's either nagkaroon ka ng viral illness such as HIV, it's either nagkaroon ka ng allergies from OTC drugs or mga herbal medicine, it could be, or nagkaroon ka, nag-take ka ng mga other medications that could suppress the platelets, or mayroon kang infection sa loob ng body that could triggers this one to produce. So, kapag nangyari yun, yung ating body magproduce siya ng anti-platelets, antibodies, or the IgG. So, kapag nag-produce yun, it could lead to two factors. The first one is magkakaroon siya ng opsonization ng platelets sa bloodstream. And the number one is to suppress niya yung production of ating platelets sa megakaryocytes sa bone marrow. So, let's go first sa antibody opsonization of platelets in the bloodstream. So, kapag may karoon ka ng IgG, yung ating spleen tsaka liver magproduce ng reticuloendothelial cells. So, ano nga ba yung function nito? Ang function nito, i-opsonize niya yung platelets by means of phagocytosis, or yung pag-i-engulf or pag-i-eliminate ng foreign body such as platelets. Ibig sabihin na pagkamalan yung platelet so another one factor, 'di ba? Sinastop niya yung production ng megakaryocytes sa bone marrow. So ibig sabihin nun, antibody specific suppression, or sinosuppress niya or pine-prevent niya yung pag-produce ng platelets sa ating bone marrow dito to produce this what we call platelets. So kapag nangyari yun, kapag merong tinatawag na antibody-specific suppression saka antibody opsonization ng platelets, it could lead to decrease of platelets or tinatawag nating thrombocytopenia. So anong nangyayari kapag mayroon kang thrombocytopenia? So dalawa ang mangyayari yun. It will decrease the lifespan of the platelets in our bloodstream. Ano nga ba yung platelets ng ating bloodstream doon? So, yung lifespan ng platelets is just only for 10 days. So, yung mga magkakaroon tayo ng insufficient platelets to form clots leads to easy bleeding. Decrease of platelets dito. Decrease of platelets. So, kapag nag-decrease ng platelets ng lifespan, ang mangyayari doon ay magpuproduce ng ating bone marrow to increase platelets production. I-produce ng bone marrow yun. So, ang mangyayari yun, magkakaroon ng increase of normal megakaryocytes. It will lead to immature larger of platelets. So, makikita natin doon as one of the indication na nagkaroon kang ng idiopathic thrombocytopenic purpura kapag nakita doon sa test na nagkaroon ka ng immature larger of platelets. So, ano namang nangyayari sa dito? Sa nagkaroon ka ng less clots that leads to easy bleeding. So, ang mangyayari yon, magkakaroon ka ng rarely serious blood or rarely lang, or this is the intracranial blood. Minsan mo lang ito maranasan. And then, first, yung pinaka makikita natin yung mucosal bleeding, or yung makikita natin sa nose, or the epistaxis, in the gums bleeding as well. And the next thing that will happen if you have an insufficient platelets is magkakaroon ka ng bleeding under the skin that leads to red or purple discoloration of various diameters. So yun yung tinatawag natin ditong makikita natin yung mga yung parang mga purple or bluish discoloration diyan kasi nagkaroon ng damage sa ating blood vessels, yun yung nangyayari kapag kaya nagkaroon ka na dito ng different color in different diameters. So, ang mangyayari is magkakaroon ka ng petechiae. Yung petechiae, yung same din yun, mga purple spots lang, pero less than lang siya na 2 millimeters, micromillimeters. Yun yung pinakaano niya. So, the next one is the purpura. Under din yan sa skin natin, pero nga lang, nasa range siya ng 2 to 10 micromillimeters. So, medyo malalaki siya. Tsaka yung pinakamalaki is yung ischimosis. Yun talaga yung pinakamalaki, yung malalaki siya dito na makikita mo. Yun indication na yun na nagkaroon ka ng idiopathic thrombocytopenic. Hi! So, what we're going to talk about today is about nursing management. So, ano nga ba yung nursing management? So, yung nursing management, ito yung ginagawa natin to treat the diseases or to have plan or treatment sa ating patient, which is usually composed of independent, dependent, and collaborative way of nursing management. So, the first one that we have to do as a nurse is to determine the risk of bleeding and activity. So, ano nga ba yung reasons bakit nagkaroon siya ng bleeding? Or gaano ba yung risk niya kataas para magkaroon ng bleeding? The next one is the history of medication of the OTC and the nutritional supplements. Kasi this, what we call the OTC drugs and OTC drugs, it could cause you allergies. So when you have allergies, so yung tendency kapag mayroong invasion or other foreign material inside the body, so magsisignal yung ating body to produce this what we call mga leukotrienes or these T cells to fight this one. So, the number one also is history of viral illness. Kapag may karoon ka ng history of viral illness such as HIV or HIV, yeah, that is one also of the reasons kasi nagiging immunosuppressed ka na. Ibig sabihin, kailangan mong malaman to kasi this is one of the reasons bakit nagkaroon siya ng ganito, purpura sa kanyang body. And the next one, it's the report mo as a nurse, yung headaches and the, what we call visual disturbances. Oh, nurse, pag for example, yung patient mo, nurse, masakit yung ulo mo. This, ikaw naman, i-report mo yan kasi it's one of the reason bakit nagkaroon siya noon. Ibig sabihin, pwede siyang nagkaroon na siya ng wet purpura or yung mas advanced stage na ng ating tinatawag na one of the clinical manifestations. So, malala na yon. So, ibig sabihin, nasa chronic stage na yung patient. And you'll also have to do a neurologic assessment with wet purpura and platelet counts. Kasi, so pag sinabi ko, as what I've said earlier, na yung wet purpura is a very dangerous type of purpura. Ibig sabihin, nasa loob yan. Ibig sabihin, nasa mga internal bleeding, hindi mo siya masyado na. What you have to do is to avoid injections, especially rectal medications, or rectal temperature should be not performed. Kasi this may induce the risk of bleeding. Kasi kapag nagkaroon ka ng injection, so magkakaroon din ng bleed. So kapag wala kang low yung platelet mo, so magbe-bleed yan na magbe-bleed kasi walang coagulation or yung walang clotting factor na nagpe-prevent ng bleeding or nagsastop ng bleeding. So the next also one is to hindi ka pwede sa rectal temperature kasi pwedeng dumugo din yung rectum ng tao. So, yun is yun. The next one is to educate the patient about petechiae, ecchymosis, and sign of serious problem. So, i-educate mo siya kapag nagkaroon ka ba ng ang tinatawag ng petechiae or yung madaming parang allergy siya na spots dito na sobrang dami. Yun, petechiae yung tawag doon. So, kapag madami ng ganun yun, i-educate mo siya na dapat bumalik siya agad sa hospital kasi it may indicate a serious problem na. So, you have also to frequency monitor the platelet count of your patient. Siyempre, as a nurse, it's your indication na i-monitor mo yung platelet count in order for you to know if there are progress ba sa mga medications na nabigay or not? Or what are other alternative treatments para maibigay ng doctor? So